بسم الله الرحمن الرحيم. محاضرتنا اليوم في موضوع oral surgery. نبدأ بساليفري gland surgery. First, we must know about the simple word about the anatomy and the physiology of salivary glands. The salivary glands is one of the glands that have called exocrine glands that have a duct that create a secretion of saliva from the gland to the oral cavity. So it is one of the exocrine glands. The classification of salivary glands, it is two categories for classification. The first one is about the size of the gland. We have two salivary glands. First, major salivary gland, and second, minor salivary glands. The major salivary glands have larger glands that can present around the face. We have three pairs, one on each side of the face, is the parotid, submandibular, and sublingual. And we have minor salivary gland, a microscopic gland that is present within the oral mucosa. This figure shows the position of each major salivary gland in the face. The first periauricular region is called parotid gland, and second, beneath the mandible, called submandibular gland, and the third one beneath within the floor of mouth, call it sublingual gland. This figure shows the gland and its ducts. The parotid gland and its duct, its parotid duct, is called senescence duct. The submandibular gland that is secrete its duct, called its submandibular duct, or call it Wharton's duct. The sublingual gland, it is have multi ducts that secrete within the submandibular duct, and it secretes to the duct to the oral cavity through the mucosa of the floor of mouth. The gland, other classification about the secretion that have secreted by the gland. We have two types of secretion, either watery secretion called serous salivary gland, or that have thick secretion called mucous salivary gland. And we have, according to that, we classify to three categories, either serous or mucous or mixed, a gland that secretes serous and mucus. We start with the parotid gland. It is about 25% volume serous cell secrete aqueous fluid as serous salivary gland. The submandibular gland, it is 70% of volume of saliva that secrete that it is mixed serous and mucus. The sublingual gland, about 4% of volume of saliva that secrete, is mixed gland with serous cell and mainly mucus cell, secreting mucin glycoprotein. So it is mainly secrete mucus, but slight serous salivary gland is present within sublingual gland. And we can see in this figure the histological feature of each gland, parotid, submandibular, sublingual. The minor salivary gland, we have about thousands of minor salivary glands all over the mouth and throat. They are most concentrated in few places, including the junction of hard palate with a soft palate in the lip, the inner lining of cheek, on the tongue, and even down in the throat. So we name it according to its location. There are labial gland that present within the lip, the buccal gland that present within the cheek, and the palatal gland that present with the palate, and lingual gland that present within the tongue. We have minor salivary gland, position, labial gland that have mixed gland. Someone is serous and other one that mucus. Buccal gland that's present in the cheek is mixed again. The palatal gland is mainly mucus. The lingual gland we divided into three parts: anterior, middle posterior that are present in the anterior part of the tongue, called it anterior lingual gland, that it is mixed. In the middle, it is serous. In the posterior, it is mucus. So that is the side, and we can see this figures the distribution of the minor salivary gland and its type of secretion. In this figure that have, you can see in the lip that minor salivary gland is enlarged due to that obstruction of duct. Salivary gland produce the saliva. Approximately 1 to 1.5 liter of the saliva is produced per day. Saliva is 90% water, about also contain protein used to moisten the mouth, initiate digestion by breakdown, stretch, help protect the teeth from decay. So the function of salivary gland is mainly to moist, not be dry, the mucosa of the oral cavity, and assist in digestion of starch as carbohydrate, and go from complicated carbohydrate to simple carbohydrate by saliva, and its enzyme is amylase, and help in cleaning the mouth and prevent there are certain IgE and IgM that prevent formation of decay in the teeth. Now we start some conditions that related with salivary gland. The first one called obstruction. Obstruction to the flow of saliva most commonly occur in the parotid and submandibular gland, usually because stone and have formed. And then they don't have any flow of the saliva from the gland to the oral cavity through its duct, mainly by stones that obstruct the duct, and it occurs mainly in the parotid, the larger one, and in the submandibular gland. The stone of the salivary gland called it sialodiathesis. Sialodiathesis is the formation of stone within salivary gland or duct in which drain the salivary glands. Salivary duct stone formation are the accumulation of calcium and phosphate crystals. These stones can be present in any one of the glands, including the parotid, the sublingual, or submandibular gland. The parotid gland lie basically in front of the ear or just behind the jaw line. The submandibular and submandibular gland sit deep within the floor of the mouth. Some disorder can cause thickening of saliva and therefore increase person risk for stone formation, like Sjogren syndrome, a condition in which causes dryness of mouth and other mucous membrane. Some autoimmune condition can also cause the body to attack its own salivary gland. This condition can cause decrease in saliva or thickening of the saliva and ultimately formation of stone. The symptoms typically occur when eating. Saliva production starts to flow but cannot exit the duct system, leading to swelling of the involved gland and significant pain, sometime within an infection. Accumulation of saliva within the gland by time lead to have growth of microorganisms and lead to infection. Unless stone totally obstructs salivary flow, the major gland will swell during eating and then gradually subside after eating, only to enlarge again at the next meal. حقيقة في حالة إنه stone not close the duct completely, there are seepage of saliva, but during eating, more saliva secreted, so not can secrete as within the duct. So the by time and after finishing meal, that decrease swelling and go the saliva outside of the gland. Infection can develop in the pool of black saliva, leading to more severe pain and swelling in the gland. If untreated for a long time, the gland may become abscessed. If a chronic bacterial infection gets into the gland, there may be scar formation in the area, and the stone is likely to be more difficult to remove. حقيقة إذا بقت الستون فترات أشهر أو سنة أو أكثر راح تتليف الجلاند، لهذا يصير more damage, not have return its secretion after removal of stone. The symptom of the stone in the duct of salivary gland: first, pain, swelling, and discomfort. Pain during meal, and an unusual taste due to decreased secretion of the saliva, associated with infection, fever, purulent discharge, and lymphadenopathy. And last thing is depend on the if parotid gland sometimes lead to dry mouth. The composition of stones. We have two compositions, organic or inorganic. The organic often predominate in the center of the stone. That's glycoprotein, mucopolysaccharide, bacteria, cellular debris. Inorganic often in the periphery. That calcium carbonate and calcium phosphatase in the form of hydroxyapatite. How prevent formation of stone in the duct of salivary gland? Salivary duct stone may be prevented by increasing the water content of own saliva. Some tips of increasing saliva water content in drinking 6 to 8 glasses of water a day and massaging the salivary gland after eating in order to clear any thickening saliva. Other methods include seeking treatment for any autoimmune disorder, seeking on sore, hard candy, and using prescription antihistamine. Salgesses is an agent or drug that increases the flow of saliva. This figure shows the occlusal view for the lower jaw that shows the big salivary gland stone within the submandibular duct, Borton's duct, and we can confirm it by a CT that we can see this white spot that form within the floor of the oral cavity. How treatment of this gland? After diagnosis it by palpation and X-ray taking, the stone may be pushed or encouraged out of duct if it is small enough by firm massage. حقيقة إذا كانت the beginning of the duct and near the orifice and it is small, by massaging the gland and push it manually outside of the duct lumen. هاي نعطيه أما اليومن جوز أو عيل شوي بحيث تزود secretion of saliva, so that secretion push the stone outside of the duct. However, for larger stones that cannot completely pass from the duct or opening, a small incision may be made to remove it, or salivary duct may be propped and thereby webbing the opening of the duct. Sometimes the gland and the stone may be have to completely excised. حقيقة إذا كانت stone بفترة قصيرة نستطيع أن نعمل incision above the duct and open it. نستعمل silver probe اللي يستعملوها بجماعة العيون لفتح nasolacrimal duct، نستعملها نفسها، نوسع الأورفيس ونضع incision above the duct or the stone and we remove it, and then not re-suture the duct but suture the wall of the duct within the mucosa of oral cavity. بس في حالة إنه فترة طويلة صارت راح نشيل الجلاند and the duct. Surgical removal of stone, however, may cause scarring of salivary duct opening. This can interfere with the gland ability to properly drain. Other problems may happen such as other stone formation along with infection. If the gland is removed, complication may include damage to one of the nearby facial nerve. This may then result in facial paralysis or loss of the sensation in face or tongue. حقيقة وجود innervation of the face within the gland خاصة parotid gland, the facial nerve pass within the matter of the salivary gland, so when remove it lead to have any paralysis of the face and lead to facial palsy. ونلاحظ in the submandibular gland مرور branching of the facial nerve or branching of the trigeminal nerve within the gland that lead have abnormality within the tongue, خاصة lingual nerve that move within the submandibular gland duct. فلهذا إذا any problem and damage lead to abnormality in the sensation of the tongue. This figure shows how we can remove it by put a stitch beyond the stone and then do incision above the stone and remove the stone from the duct, and it is finished the operation. Second disease is infection. The most common salivary gland infection in children is mumps, which involve the parotid gland. The mumps is viral infection. While this is most common in children who have not been immunized, it can occur in adults. حقيقة وجود لقاح ضد المبس النكاف هذه أكثر شيء يصير في الغدة النكفية اللي هي الباراتيد جلاند، وتلقح تلقيحات موجودة، بس في حال عدم تلقيحها يكون معرض أكثر في حالة حتى البالغين أنه يصاب بالمبس. However, if an adult has swelling in the area of parotid gland only on the side, it's more likely due to an obstruction of tumor. حقيقة المبس bilaterally، فإذا صارت انتفاخ في جهة واحدة من الفيس in one side of parotid gland that not have mumps, but it's mainly obstruction of the duct or there are tumor, benign or malignant tumor. The infection of the salivary gland called it adenitis. There are acute or chronic. The acute infection more often affect the major gland than the minor glands. The acute adenitis, they have their sign and symptom, their pain, severe pain, swelling, redness of the skin, bad taste from pus, and less salivary secretion. Bacterial adenitis, that clinical picture, sudden onset, gland is painful, indurated, erythematous overlying skin, and eyes rises the lobule of the ear, the temperature above 37.8 degrees centigrade, that it is acute infection. The chronic adenitis. Causative event is thought to be a large secretion rate with subsequent salivary stasis, more common in parotid gland. Damage from bouts of acute adenitis over time lead to progressive acinar destruction combined with the lymphocyte infiltration. Chronic recurrent parotitis. The affection of parotid gland called it parotitis. The age between 3 to 6 years, caused by Streptococcus viridans, may spontaneously heal during the puberty. The other infection is a secondary infection of salivary gland from nearby lymph node. These lymph nodes are the structure in the upper neck and that often become tender during a common sore throat. حقيقة وجود lymph node within the major salivary gland like parotid gland and submammary gland, so any infection of this node lead to infection of the gland. In fact, many of these lymph nodes are actually located within the deep substance of parotid gland or near the submandibular gland. When these lymph nodes enlarge through infection, a red, painful swelling in the area of parotid or submandibular gland. Lymph nodes also enlarge due to tumor or inflammation. مو فقط الانفكشن bacterial infection or viral infection يؤدي الى lymph node lymphadenitis، أيضا the inflammation as autoimmune inflammation or the tumor, benign or malignant tumor of lymph node. Other type that lead to adenitis is inflammatory adenitis, is allergic adenitis. This occurs when have any substance that attack to the salivary gland that during eating that lead to have any inflammation of the heart, lead to a sign of inflammation. So when treated, self-limited disease, suppurative therapy, avoid allergen and hydration. حقيقة هو can be go by itself and not need more water and stop taking allergen that lead to adenitis. The causes of adenitis divided to infection or inflammation or traumatic. There are viral infection and bacterial infection. Viral infection like mumps, Epstein-Barr virus, para-influenza HIV virus. Bacterial infection like Staphylococcus aureus, Streptococcus viridis, Haemophilus influenzae, Streptococcus sebaceus, Streptococcus pneumoniae, and Escherichia coli and bacteroides. The immunity like HIV, big lymphoepithelial disease, Sjogren syndrome, juvenile rheumatoid arthritis, ankylosing spondylitis, IgA deficiency, ulcerative colitis, and rheumatoid arthritis. In traumatic condition, penetrating blunt radiation obstruction like stone. Other disease that affect salivary gland that called it salivary gland cyst. We have four types of cyst within salivary gland. The first one called seal, mucocele, oral ranula, and cervical ranula. The salivary gland cysts occur as a result of trauma or obstruction to the salivary gland excretory duct and spillage of saliva into surrounding soft tissue. The blocked duct does not allow the saliva to exit into mouth. The saliva therefore gets back up in the gland and results in enlargement and ballooning of the gland. Salivary gland cyst can be classified as ثالث mucocele, oral ranula, and cervical ranula. سابقا كانت ثلاث حالات هي الثالث mucocele and ranula، والرانيولا قسموها إلى قسمين oral ranula and cervical ranula. First, the salivary. Salivary are cysts of major salivary gland origin. Salivary are painless swelling of minor major salivary gland. حقيقة, the only enlargement without any pain occur in the parotid or submandibular gland. The real cyst and most important one is mucocele. Mucocele are cysts of minor salivary gland origin. Mucocele are painless, asymptomatic swelling that have relatively rapid onset and fluence in size. حقيقة هذه تحدث أكثر شيء بالليبيال نتيجة التروما from the anterior teeth to the ductus, microscopic duct of the gland, and lead to easily fibrose and close the minor salivary gland duct and lead to have a cystic lesion, is painless and rapidly enlarged, is not have any problem, and only aesthetically that lead to have a problem to patient. This figure shows the lower lip is more common than upper lip due to from the upper teeth that lead to damage to the duct of the minor salivary gland. Oral ranula. This term derived from the Greek word of swelling area below the mouth of the frog. Ranula is the floor of frog that is an example of the oral cavity. Oral ranula are painless cysts that occur in the floor of mouth and usually involve the major salivary gland. They not extend beyond the mouth. Oral ranula usually present with a swelling in the floor of mouth that is painless. On occasion they can interfere with the speech or chewing. حقيقة الرانيولا تحدث بالduct of the submandibular gland within the floor. إذا صارت بالاتجاهين راح تكون مثل الرانيولا of the frog. Cervical ranula, also known as plunging ranulas, are cysts that occur in the floor of mouth and extend plunging in the neck. The cervical ranula is present as painless swelling in the neck. حقيقة at the below submandibular area that have swelling in the skin in this area, that is the cervical ranula. That extension not to the oral cavity to outside of the oral cavity. Treatment of the cyst of salivary gland. Occasionally salivary cysts spontaneously resolve, especially in infant and young children. Although aspiration of salivary cysts does default them, this is temporary and almost all cysts return after aspiration. Small and asymptomatic salivary cysts can be observed. حقيقة في الأطفال أو حديثي الولادة تظهر حالات السيست بس by time is dissolved and go without any treatment. بس في حالة إنه stay for long period الاسبريشن ما راح يفيدنا ترجع تتكون مرة الأخرى بس تكون remove it. However, if cellular seal become symptomatic of salivary flow or get infected or become cosmetically noticeable, surgical excision is recommended. Surgical excision involve remove of salivary gland and that contain the cyst. حقيقة الميوكوسيل هي مو فقط نرفع الرانيولا، نرفع microscopic gland again. If the mucosal is small and superficial, it may respond to topical steroid treatment. Larger mucosal require surgical removal for definitive treatment. حقيقة الستيرويد استعمالها كلش قليل لأنه تأثيرات السلبية كلش هواية، ولكن remove of the cyst with the gland is more useful and more treatable one. The preferred method of treatment of oral ranula is complete excision of the ranula and the associated sublingual gland. Drainage, marginalization, excision of the ranula without excision of the associated sublingual gland result in higher rate of recurrence of ranula. إذا الرانيولا اللي يصير بالسبلينgual gland هي remove it and remove the gland that have its problem. The preferred method of treatment of cervical ranula is complete surgical excision of oral portion of the ranula with the associated sublingual salivary gland and drainage of cervical cyst. The most important factor in surgical management for cervical ranula is removal of responsible major salivary glands. Other disease is tumors. The tumors either benign or malignant tumor. So primary benign and malignant salivary gland tumor usually show up as the painless enlargement of these glands. حقيقة حال أي tumor in the body هو without any pain occurred during the enlargement and growth of the tumor within the glands. Tumor rarely involve more than one gland and are detected as growth in the parotid submandibular area on the palate floor of mouth, teeth, or lip. حقيقة التيومر يكون unilateral, not bilateral, not multi-gland effect, and occur in major salivary gland and minor salivary glands. These are most common in the parotid gland. About 80% are benign tumor and typically present as a slow-growing salivary mass. حقيقة أكثر الحالات هي benign وتكون slow-growing, not rapid growing, تحتاج إلى years to be enlarged. And about 80% of the tumor is benign. The risk of salivary lump being malignant is higher for submandibular tumor. About 50% are malignant. حقيقة submandibular tumor, half of that mass is malignant and half benign. The most tumor occurring in the major salivary gland are malignant, but these are rare. حقيقة minor salivary gland أكثرها benign بس malignant موجودة بس قليلة. Factors suggesting that salivary lesion may be malignant include شلون نفرق بين المالجنت and benign that من خلال the rapid growth. المالجنت يكون in like days and not exceed than 1 month, but in benign it go for more 1 year or more. Fixation of tumor to adjacent structure. حقيقة راح يكون tethering with the skin or muscle or within the bone that's surrounding the gland. Facial nerve involvement invasion resulting in facial muscle weakness. حقيقة in the parotid gland المالجنت راح يكون facial nerve أيضا involvement and lead to have a weakness and facial paralysis. The presence of large neck lymph node, although this may also be found with inflammatory lesion. حقيقة lymph node enlargement تؤدي إلى حالتين، أما نتيجة inflammation أو نتيجة malignant disease، وهذا من خلال نلاحظ fluctuation of the lymph node إذا كانت fluctuant هو inflammation، إذا كان hard or rocky hard معناها malignant. You start the benign parotid tumor. The most common benign parotid tumor is pleomorphic adenoma, which is solid mass at the side of the face in the periauricular region. The second most common benign lesion is Wharton's tumor, which is cystic cyst adenoma, and most commonly found in the inferior portion of the parotid gland, in the lower lobe of the ear. They present as firm but mobile mass, but they can become quite large if left untreated. حقيقة الورثن تيومر يبدأ صغير فترات طويلة وهو موبايل not skin can move movable above this mass. The majority, about 80 to 90% of the parotid tumor occur in the superficial aspect of the gland, superficial to the facial nerve, because 80 to 90% the gland is superficial to the nerve. حقيقة احنا نقسم البارotid gland إذا تذكرون إلى قسمين, superficial and deep, واللي يقسمها هو passing of the facial nerve within the mass of the gland. أكثرية majority of gland هو superficial, فلهذا الماس راح تكون superficial more than in the deep. In 10 to 20% of cases, however, tumor occur in the deep part of the gland, and such lesion can even present as lump in the throat with expansion of an area called parapharyngeal space at the back of mouth. In this later setting, the lump may be visible by looking inside my mouth. هذه في حالة إنه increase in size in the deep part that go within the oral cavity, not in the outside. Benign salivary gland tumor only rarely cause facial weakness, a finding that is virtually diagnosis of malignancy. However, polymorphic adenoma have a risk of malignant change over a long period of time. حقيقة polymorphic adenoma or Wharton tumor ما تأثر لنا على الفيشال nerve and it's not have حتى لو كان superficial and deep involvement. بس إذا فقط فترات طويلة تتحول من البناء إلى المالجنسي راح تأثر على الفيشال nerve. The malignant parotid tumor. The most common malignant tumor, about 70% and plus of parotid gland, occur as a result of involvement of lymph gland represented in the parotid by either squamous cell carcinoma or melanoma of the skin of the face or the scalp. These are highly aggressive tumors that often also spread to lymph node in the neck. This tumor can involve the facial nerve, causing facial weakness. The mass feels hard and irregular and can be fixed to deep structure and or invade the overlying skin, causing discoloration or ulceration. They may be palpable lymph node in the neck, most frequent in the upper deep cervical region, level 2 of lymph node, immediately below the parotid gland. There are three types of malignant salivary gland tumor. First, mucoepidermoid carcinoma, adenoid cystic carcinoma, and actinic cell carcinoma, besides the presence of lymph nodes that have squamous cell carcinoma present with the parotid lymph gland. The second gland is the submandibular gland tumor. 50% of these are malignant. This mass is below the jaw. If malignant, they can invade adjacent structure and cause facial weakness and abnormalities in tongue function. If malignant, there again may be associated with large lymph nodes that have near the submandibular gland. The last major cellular gland is sublingual tumor. The commonest tumor here is mucous cyst called ranula. This may be confined to floor of mouth, simple ranula, or they may extend down the neck, bulging or leaving ranula called cervical ranula. The malignancy of the sublingual gland are rare and usually present as hard mass in the floor of mouth and can often involve lingual nerve, causing numbness in the floor of mouth and in the tongue. The minor salivary gland tumor. These are rare and virtually all are malignant. They are most common in the palate. The most common type is adenocystic malignancy, which has tendency to invade a long nerve and has high incidence of local recurrence irrespective of the treatment employed. This figure shows the malignant tumor of the minor salivary gland within the tongue, within the heart palate, anterior part and posterior part. This figure shows distribution of cirrus according to histological findings, the histology and the number of cases. Cystic adenoid carcinoma, about 80%, adenocarcinoma, about 11%, low-grade mucoepidermal carcinoma, high-grade mucoepidermal carcinoma, and epidermoid carcinoma, 7%, carcinoma extra-adenoma is 6%, low-grade polymorphic adenoma, adenocarcinoma, and undifferentiated carcinoma is 5%, ethnic cell carcinoma, clear cell carcinoma, about 3%, and ductal carcinoma, low-grade polymorphic carcinoma, basoid myoepithelial carcinoma is about 1%. Salivary gland enlargement also occurs in autoimmune disease such as HIV virus and Sjogren's syndrome, where the immune system attacks the salivary gland, causing significant inflammation. Dry mouth or dry eye are common. This may occur with other systemic such as rheumatoid arthritis. Diabetes may cause enlargement of salivary gland, especially the parotid gland. Alcoholics may have salivary gland swelling, usually on both sides. This figure shows the salivary gland bilaterally in Sjogren's syndrome that affect the salivary gland and the lacrimal gland in the eye, and is one important feature of Sjogren's syndrome. How diagnosis of diseases of salivary gland? The diagnosis of salivary gland disease depends on the careful taking of history and physical examination and laboratory tests. We take some radiographic findings like plain radiography and cystography, ultrasound, and more complicated investigation that computerized tomography and magnetic resonance image scanning. This figure shows that have cystography and CT and MRI for the diseases, mainly malignant tumor of the salivary gland. Other investigation, laboratory investigation من خلال fine needle aspiration biopsy is helpful. A lip biopsy of minor salivary gland may be needed to identify certain autoimmune disease. Treatment of salivary gland disease fell into two categories, medical or surgical. Selection of treatment depends on the nature of problem. If it is due to systemic disease that involves the whole body, not one isolated area, then the underlying problem must be treated. If the disease processes related salivary gland obstruction and subsequent infection increase fluid intake and may prescribe antibiotics sometime, an instrument will be used to open blocked duct من خلال salivary needle لتستعمل بفتح nasolacrimal duct. If a mass has developed within the salivary gland, removal of mass may be recommended. Most mass in parotid gland area are benign tumor. When surgery is necessary, parotidectomy is the removal of parotid gland. The parotid is usually removed because of tumor, chronic infection, or blocked salivary gland. During surgery, great care must be taken to avoid damage to facial nerve within this gland that move the muscle face, including the mouth and eye. حقيقة أن superficial part of the purific adenoma يجب نبدي نعين الفيشل نيرف قبل ما نشيل التيومر، وإذا كان الديب يجب أنه نرفع الفيشل نيرف حتى لا يصير أي problem to the face or eye. When malignant mass are in parotid gland, it may be possible to surgical removal them and preserve most of facial nerve. Radiation treatment is often recommended after surgery. This is typically administered 4 to 6 weeks after surgical procedure to allow adequate healing before radiation. حقيقة الكومبينيشن تريتمنت ما بين سيرجري وراديشن موجودة بالمالجنانت الباراتيد وتأثيرات كثيرة على الجسم، فلهذا يجب أنه بعد العملية رفع الباراتكتومي يجب أنه فيلينج بيريد ما تراوح من 4 إلى 6 أسابيع بعدين نعمل الراديشن. This figures shows how the diagnosis and removal of parotid gland by parotidectomy. This three-dimension of its submandibular gland tumor, removing part of the mandible and return to its position by the use of mini plate or bony plate. This figure shows the submandibular region that remove it by surgery. And this histopathology of the malignant tumor. And this is the presence of facial nerve within parotid gland. How can detect it? Either two way. أما نأتي من main trunk from periauricular area وندخل and can see the 5 branches, or we go to the buccal branch from anterior side of the view and go inside to see the other branch to reach the main trunk. The complication following parotidectomy. The first one, facial nerve injury, sensory nerve injury, bleeding, salivary leak, facial sweating like freeze syndrome. حقيقة freeze syndrome هو أنه السليفري when eating the patient secrete not only saliva, secrete the sweating and the have is that كمية التعرق عندما الإنسان يأكل. ليش؟ لأن تتحفز السويت gland ويا السليفري gland. Removal of salivary gland does not produce a dry mouth, called xerostomia. However, radiation therapy to mouth can cause the unpleasant symptom associated with reduced salivary flow. Medication or other conservative treatment may reduce the dryness in this instance. حقيقة في حالة إنه يكون dry mouth هالحالة نسميها xerostomia. معناها xerostomia هو reduce or not produce any saliva. فإذا رفعت one gland, there are other minor salivary gland and other glands, major salivary glands can secrete and don't have any dryness. بس في حالات إنه البيشنت يتعرض إلى راديشن كل الأورال كافيتي راح كل السليفري جلاند تتأثر وتؤدينا إلى dryness. فأخذ بعض العلاجات اللي تأثر على المين secretion of the gland to all minor and major salivary gland أيضا تؤدينا إلى dryness. The confidence is co-education, so its lack of confidence is the most important in the surgery. Thank you for your listening to this lecture.